Welcome back. This is Dr. Mary Tipton, and I'm here to tell you a little bit more about direct primary care and why I chose this model as the model for my future practice, Blossom Health. Healthcare is just a hassle. It's a hassle for patients, it's a hassle for physicians as well, and my goal is to make it less of a hassle with the direct primary care model. So when you're trying to make appointments, for example, in the insurance-based system, there's just a lot of waiting involved. We all know you have to wait to get your appointment because there's problems with access. You have to wait to get on the phone maybe because there's a lot of people in line ahead of you. You have to wait when you get to the office in a line to check in because they got to verify your insurance eligibility and take your copay and all this other nonsense. You're waiting in the exam room, and then after that you might even be waiting because your doctor doesn't even have the records that they need to discuss your care with you because, heaven forbid, they couldn't get the CAT scan from right across the street because even though it's right across the street, they're not connected because they have to wait for the fax to come in. Are we in the 1980s? We're faxing medical records. In contrast, other businesses seem to be able to serve me with great ability of convenience and transparency and hassle elimination. For example, I'm looking for a bank recently, and boy, these bankers are falling all over themselves to give me some convenient solution that I can utilize, that has value, that shows their expertise. I have some personal banker who told me, I don't even have to have you come into the branch ever. I can do everything remotely. And I'm like, I am totally sold on this. So I just believe there's got to be a way to make healthcare less of a hassle. Frequently, when I'm seeing patients these days, because I'm so booked, they had to see another provider 1, 2, 3 times. And then I'm looking back at what happened. They've been battling this cough for a month. They've been having this behavior problem in their family. Maybe their blood sugars are uncontrolled. Their prescriptions have been getting denied. And I am just, quite frankly, I'm incensed because I don't want that for my patients. I want things to be more efficient. I want them to get the care that they need. And sometimes they're seeing providers that are a lot less experienced than me, but that's not actually usually the case. They're just seeing a person who doesn't really have a longitudinal relationship with them. They're seeing someone who's just there to address that problem just for the day and kind of patch it up and move them along. And when I know them and I could see them maybe more quickly, more efficiently, and get their problem solved, I could have perhaps been able to offer them a solution much sooner. And in direct primary care model, when I'm the only person seeing the patient and we have that continuity, we have a longitudinal relationship, there's timely access to me, without these typical barriers of insurance system, I believe that we could provide healthcare that is a lot less of a hassle. So consider joining Blossom Health because it's a direct primary care model, and that is healthcare without the hassle.